So why does vitamin D control psoriasis? Because the genes that it affects. It restores the functional status of regulatory T lymphocytes.
Mm-hmm.
If you go read the regulatory T lymphocyte, if you read my paper that I wrote in 2021, you're going to find a couple hundred references about regulatory T lymphocytes and how oral vitamin D, topical vitamin D, sunshine, and phototherapy restore the functional status of regulatory T lymphocytes. So what do regulatory T lymphocytes do? They turn off autoimmune diseases, every one of them. MS, psoriasis, you name it.
So rewind a little bit, because we kind of skipped over, just so that the general person understands, yes, vitamin D has this effect on your genes, turning them on or off. And then the end result is that it has an effect on the T lymphocytes, on these immune cells. But what exactly is it doing when it turns these genes on and off? How does it work to affect the immune cells and to have this overall effect on autoimmune disease and so many other diseases?
There's like 3,000 genes that it controls. We know what a couple of the products are. There's most of them, we don't know what the gene products are. And so we don't know exactly what those gene products do because we don't even know what they are. But vitamin D deficiency is associated with a host of medical problems, cancers, every type of cancer you can imagine, in especially prostate cancer, breast cancer, colon cancer. Those are the big three that there's a lot of data on. When you're deficient, your risk for those cancers goes way up, right? When you have a higher levels, Cedric Garland did a lot of that research, right? He's got a lot of those publications. He was a real pioneer in this field, and he's still actively involved with it. So if your 25-hydroxyvitamin D level gets higher, your risk for cancer goes down, right? So why is that? Vitamin D causes cells to terminally differentiate. How does it do that? Well, through whatever genes it is that it's controlling. I can't tell you the exact mechanism because we just don't have that data. But what we need to do is figure out what genes does vitamin D affect, and what are the gene products, and what do they do? That's where there's a lot of need for research. Mm-hmm. I'm unique in the fact that I was doing this for 2.5 years before these two medicines came out with their recommendations. And I had a whole hospital full of patients I had to take care of, right? And I wasn't going to cause them any harm. And if you go back to that meeting that I went to in Toronto, Canada in November, Robert Heaney gave a lecture. I got to meet him and Reinhold Beef. I went over Robert's paper with him, dose response study, and told him what I was doing. And I said, "Are you okay with it?" He said, "I support what you're doing." So I got the blessing from the world's leading expert in vitamin D at the time. Well, Robert gave a lecture. He talked about a study that I was totally unaware of. It's published in 2006 in Science, and the first author was Dr. Liu. Here it is. You can see it. It's called Toll-like receptor triggering of a vitamin D-mediated human antimicrobial response. So what does that mean? Well, throughout the 1990s and early 2000s, scientists discovered that certain cells in the body can make antibiotics. Our bodies have cells that can make antibiotics. They call them antimicrobial peptides. And these things are able to kill multiple different types of microorganisms. Tuberculosis, mycobacterium tuberculosis, different bacteria, parasites, fungi, envelope viruses. Just about any type of microorganism, these antimicrobial peptides are active against. So the question was, how do they form? What triggers their formation? What's the whole mechanism where the cells are told you need to start making these things, and then what causes them to get made? Well, what they figured out was so these guys were looking at white blood cells in tuberculosis, and they were trying to understand what does TB evade the immune system? So, and this is a tribute to these guys. These are the really amazing people who can figure this stuff out. I just read about it and learn it. And I said, okay, well, I'm going to give these guys this much vitamin D because this is going to stop all these problems. I can cure TB with this stuff. I can control asthma. I can control psoriasis. You just got to use the right amount. Don't use the super physiologic doses that they used in the 30s and 40s. Use the physiologic doses. If you use subphysiologic doses that the Institute of Medicine is promoting, you don't see a response. Use the physiologic doses, you do. So what happens when what they discovered was when the TV protein attached to the cell surface via toll-like receptor, it caused a cascade of reactions to occur. And they found 2 genes that were turned on right away. One gene was the gene that makes the vitamin D receptor. The second gene was a gene that makes an enzyme called 1-alpha hydroxylase, 25-hydroxy vitamin D 1-alpha hydroxylase. So what does that mean? That's the enzyme that converts circulating 25-hydroxy vitamin D, which has a 2-week half-life, into 125-hydroxy vitamin D on demand when the body needs it. So why is it doing that? They said, oh, well, it must be turning on the vitamin D dependent gene. What gene is it and what does it make? And they isolated the gene product. It was cathelicidin. It was antimicrobial peptide. It was the stuff that kills the microorganisms. So they figured it out. It was a landmark study, you know. So when I learned that, I said, I'm never going to let a patient be vitamin D deficient again the rest of my life, because they need to be able to turn this thing on. Yeah, I remember I had a friend at work at Drake Center. We would get really medically compromised patients. We would get them straight out of the intensive care unit from University of Cincinnati because they couldn't wean from that. These guys hadn't been out of bed for weeks. They had lots of different medical reasons why they ended up on a vent. You know, they're getting some kind of tube feed, they can't walk, they might have a big wound, have a wound back on them. They were just, you know, and we got them better. We got them off of that. And a friend of mine joked one time when I was working with my colleagues, oh, I can't let them be antibiotic deficient. I gotta make sure I get them on some antibiotics for the weekend. And I thought, yeah, that's kind of funny. That's before I figured out about the antibiotic, about the vitamin D. But, you know, so that was a really big moment for me when Robert Heaney gave that lecture and I learned about that study.